Today, as everybody knows, I think is June 15th, which marks the end of the state of emergency, which is another turning point here in Massachusetts in the fight against COVID. We've made it through the past 16 months because of the resiliency, kindness, creativity, imagination, and commitment that the people of Massachusetts made to themselves and to one another. You buckled down, you followed the public health guidance and the science, and you made tremendously difficult decisions and sacrifices to get us to this point. We've made tremendous progress so far, but the best tool we have to drive down and out COVID once and for all is for more people to continue to get vaccinated here in Massachusetts. And the effectiveness of these vaccines is clear, especially when you look at our own public health trends. Today, cases are down 99% since their peak in January. Hospitalizations are down 93% since their peak, and the positivity rate is down 95%. The single biggest driver in that, and there's been a number of studies that have been done now across the nation that make this quite clear, is that people getting vaccinated has the most significant impact on all of this. Now, last March, when we were still unsure of what COVID was, how to deal with it, how to fight it, we stood up the COVID-19 Command Center, which was overseen by Secretary Sudders, and it's been the strategic source for much of the things we've done as an administration over the course of the past year. From testing to contact tracing to PPE to monitoring hospital surge capacity to standing up field hospitals and isolation and recovery centers to working with our colleagues in congregate and long-term care, to vaccine distribution and everything else in between, the command centers had a huge role to play in all of our efforts. Today, as we mark the end of the state of emergency, we're also announcing that we're stepping down the COVID-19 Command Center. We also had the last formal meeting of our Medical Advisory Board last week. The Medical Advisory Board met weekly with me and Lieutenant Governor Polito and Secretary Sudders and a number of folks at DPH and other folks in our administration to provide us with sound scientific advice as we weighed various decisions throughout the course of this pandemic. I want to thank publicly, we've done it privately, but I want to thank publicly everybody who served as part of that command center and on our Medical Advisory Board. They made an enormous difference to the people of the Commonwealth over the course of the past 15 months. And while we're formally transitioning out of the command center, we'll continue to monitor all of the public health data that we've been tracking since this began. But the most important point I want to make today is how clear it is at this point, based on the experience we've had here in the Commonwealth and people have had in so many other places, that the vaccines work. They are our way to getting back to normal. It's the best way to protect yourself, your loved ones, and your friends. It's safe, it's free, and it's easier to get than ever. There are over 900 vaccination locations across the Commonwealth. You don't need insurance. Many sites offer walk-up appointments. And if you're looking for a vaccination location, you can always visit mass.gov/COVID-19.